Hi, I'm here today with Jessica McIntyre. You are the District Mental Health Specialist for Volusia County Schools. Thank you for being here.
Thank you for having me.
Absolutely. And I don't want to mess this up. So you oversee the district mental health team as well as coordinate the mental health department of Volusia County Schools.
Yes, that's correct.
Okay. Would you mind telling us how this department came to be?
Sure. So with Volusia County Schools, we're actually entering into our third year of the district mental health team. Our funding came after Senate Bill 7026, also known as the Marjorie Stoneman Douglas Public Safety Act. And that provides mental health funding for all of Florida's 67 school districts. The allocation was intended to expand school mental health care, train educators in responding to mental health issues, as well as connect children and families to different resources, both mental and behavioral health. For Volusia, when developing this program, we decided to do in-house, which means we have our own staff of licensed mental health clinicians, school social workers, and school psychs to be able to help and respond to these different situations our students might be dealing with.
Okay, so with the in-house, that gives you a different dynamic into the mental health services. So
Yes.
what programs and services do you guys offer?
Yes, so hiring an in-house team definitely has many advantages. We have more oversight, professional development targeted to educational issues, as well as ensuring that the practices that our clinicians utilize align with the policies and procedures of the district. Our team works with many outside agencies as well to help set up therapy services, case management, and medication management if needed. For those not insured, our families can also be assisted with offering short-term, we utilize brief solution focused therapy for our students, and we can offer that from our clinicians in-house at the school sites and help link them with insurance coverage if they need more additional assistance, such as with Florida Kid Care. And if they have private insurance, we can also help them navigate that to find an in-network provider. So we do a little bit of everything for them.
That's incredible. I love that. So you mentioned you do work with, you partner with other agencies, mental health agencies. Are there a few that you'd like to speak about? I'm sure it's hard to list all of them. But
Yes, so we work with our community-based agencies to get the services to our students. We have 6 agencies that we pair with. We do work with some other agencies as well, but those 6 actually come into the schools to offer services.
Okay.
So we have Halifax Behavioral, or HBS, Stuart Marchman for our substance abuse counselors. We utilize them for that, as well as ADAPT, Chrysalis, Devereaux, and Children's Home Society. So we also utilize HBS to assist us with coordinating with families for any of our students that do end up staying there overnight, so that we can coordinate for reentry meetings. Just so that then when the students do come back, we have a support plan set in place.
I love that. I love that, which is an important factor when transitioning back from such an experience. So do you have some overall goals within the mental health team for the students and the school itself?
Yes. So overall for our district mental health team, we really want to make sure that all students are able to get the help that they need and that they deserve. We want to make sure that there's that support, that consistency for our families as much as possible so that we can help them in any way that they can. Be that offering short-term counseling services, linking them to a provider, or finding additional financial or housing supports. We want to ensure that that communication is there and that consistency whenever possible, because our families and students need to have their voices heard in treatment. So we want to hear from them on what kind of supports they really need.
Okay, I love that, and you're right, that is a huge part of just being validated in the mental health world. So I noticed that, and you've spoken to, taking a very proactive and having a follow-up approach with the students and the families. What other ways do you guys work to try to make sure that no child and no family is left behind in navigating their mental health needs and things of that nature?
So yes, that's really where our short-term therapy sessions that our clinicians can offer really come in, because we don't want any students to fall through the cracks. So if a family doesn't have the ability to pay due to lack of insurance with one of our in-network providers, we can offer them anywhere from 4, 6, 8 sessions to help get the student and the family as stable as possible. Possibly in that meantime, while we're offering those short-term services, that might just be all that they need. They just might need that extra time. Or in that time, we're able to link them to something longer term or help get them linked up with insurance. So again, our goal is to offer supports, and we don't want any student or family to feel like they can't get help if they really need it.
Yeah, no, that's incredible and such an important component to mental health services and treatment. So with the pandemic being present, and hopefully we will be coming to an end point of that, but have you seen challenges specific in the mental health field to the pandemic, related to the pandemic, and what students or staff or both are facing?
Yeah, we're seeing a lot with not just our students, but also our staff.
Okay.
Things are really hitting everybody hard, and I think especially now because it's been going on for so long. But for what we're seeing for the district mental health team, and some of those obstacles we're trying to get over right now, is the distance in transportation for our students. Because again, we have some students that are on VOL, on live, some are in person. So we've been trying to utilize more platforms to offer those telehealth services to our students. We're also looking into ways to serve our students to where if transportation is an issue, we can get those consents signed. Because again, another barrier. But we don't want the struggles that people are already facing then mounted with, I can't get there to sign a document, to keep them from getting the services that they need. So there's a lot of different things that we're trying to navigate. So already with the stigma associated with mental health that we're trying to cut out, that mixed with COVID has definitely added another layer onto how we perceive and how we work through our everyday lives. So we definitely want to try to make things as easy as possible for our families.
Right, and yes, I can imagine that that's caused quite a few unknown challenges that you're having to address immediately. So, too, I wondered if you have been able to track, or if there's any data that has been presented to show what effects might be lingering past the crisis level of the pandemic, when things are starting to reorient to a different normal. Do you foresee any mental health challenges for staff and or students after the fact?
Yes, we are definitely seeing an increase, and I think just because things are really starting to get ahead. Kids have been home for too long. We're not going out as much as we were, so we're really seeing that this is something starting to affect more and more of our staff as well as our students. But not only just those issues of being home, it's whether or not for our students do they have that consistency. The structure in their lives has changed. Support at home while completing assignments could be another thing. All of that pressured with just being a kid and you know, just trying to do well and get through the day. We're definitely seeing more behavioral concerns and difficulty with some self-regulation with some of our age groups. Again, stemming from that everyday difficulty, and there are different schooling options. Again, as I mentioned, we've had a lot of kids coming back now to the schools that have been on live, been on VOL. So again, how that classroom structure has also had to change. So just in general, the quarantine, changes in our habits, our structure, these are all taking a toll on our staff, on our students. So like I said, this next month will be a year that, that we've been working. So we're continuing to change, and we're just going to take it day by day.
Right, yes. Well, and it's interesting to see, it's interesting that you guys are already tracking that data and seeing some indicators for what may need to have some resolutions moving ahead.
Yes.
So one of the, we're actually here today related to the DeLand Chamber of Commerce and Orange City Alliance Education Committee and the Crystal Apple Awards. So thank you so much for participating in this interview, because wellness is an important part to the Chamber with the Wellness Initiative, as well as the Education Committee being the challenges 2020 and 2021 has faced. You've mentioned the teachers somewhat throughout this interview. Would you like to speak about some of the mental health trainings or mental health aspects that are current and present for the teachers within Volusia County?
Sure. So we, again, part of the state mandate is that our staff be trained in some form of an approved district-wide mental health training. Okay. For that, we're using something called Youth Mental Health First Aid. In no way does this training make any of our teachers or our staff a mental health professional, but instead it teaches you how to recognize the warning signs. how to start that conversation, how to bring a student to the correct person, how to start that all in motion. So all employees of Volusia County Schools receive that training, from teachers to admin, from Schoolway Cafe to transportation. At the beginning of the school year, we had roughly about 80% of the district currently trained. And again, with entering the third year, we are starting now to do our certification process, because the certification is good for 3 years. So we'll be starting that with a lot of our administrators and counselors here in the next few months. But also, besides the youth mental health first aid training, we're also continuing to do a lot of SEL, or social emotional learning, and that is really geared with a lot of our school counselors and our teachers inside the classrooms.
Okay.
So for that, in our elementary schools, we're seeing a lot of use of a program called Sanford Harmony.
Okay.
And that really is wonderful to foster communication and connection in our elementary school students. For our secondary counselors, they've been trained in something called Student Success Skills, which is another SEL curriculum. Our teachers and staff are using a lot more of restorative practices, peer mediation in the classrooms to assist with some of those de-escalation processes. And then also we've implemented something called the Y-Try program. And the Y-Try program is a nationally recognized program for our in-school suspension students.
Okay.
So again, those schools that offer that, we are training those teachers who specifically work in that to help build relationships with those students, to teach important life skills in a positive and a safe environment. So again, we're constantly within the district looking to see how we can improve and better work with our teachers, our staff, because they're the ones who are setting that stage for our students to grow academically, socially, and emotionally.
Absolutely, and it does. It sounds like your department has done a phenomenal job at taking the whole picture approach of the student and the school and their needs, and working as best you can to identify it. And truly in such a short amount of time, I mean, just nearly 3 years, there's a lot of accomplishments that you've gotten done there. So I want to thank you for your time. And is there anything you'd like to add, or anything more you'd like to share in related to wellness and our Volusia County schools?
I am very happy to hear that the DeLand Chamber is taking such a deep dive into mental wellness and health in general, and I really appreciate the time to be able to come and talk about what our district is doing, because we're such a heart of the community as well.
Absolutely. Thank you so much for your time.
Thank you.